Thank you so much for having me today. Let me get my presentation ready to share with you. All right, so these are our three original scientific founders. They're all three dermatologists who are very renowned, and they are known for innovating technologies such as lasers, which is selective photothermolysis, fractional lasers, so fractional skin resurfacing, cool sculpting or cryolipolysis, photodynamic therapy, RF needling, a host of really incredible technologies that have really changed the aesthetic landscape. So, when they started off tinkering with cold, it ended up as R2 technologies. And we realized, wouldn't it be amazing if we could also offer another option to, the aesthetic providers out there that both adds new and return patients and also expands the population of patients that they can treat. And then on top of that, wouldn't it be fantastic as well if that option also yielded very high patient satisfaction? Oftentimes in our industry, there are many technologies that might yield a good result, but the patients may not be satisfied due to downtime or discomfort. But one of the things that we're very proud of and very excited to share with the team is that Glacial RX, I think, is a device that patients generally really enjoy and would do it again and would recommend it to their friends. So a little bit more about Glacial RX and our FDA indication. So the Glacial RX device, as you see it on the right side, it has a touchscreen interface with a handpiece that delivers the cold. And then the bottom is the chiller. And it's the first and only aesthetic medical device that uses cryomodulation, so using cold to modulate skin appearance, then effectively and comfortably address skin inflammation, as well as reduction of benign lesions. So it has a twofold aspect. It has the ability to remove benign lesions of the skin, such as lentigines, seborrheic keratoses, and it also has the ability to have the temporary reduction of pain, swelling, and inflammation, which is really novel because many of the devices in our industry are very heat-based and therefore cause a little bit of discomfort as they're delivering the treatment. So with Glacial RX, it happens that we have the 3 C's, or, cryomodulation, no chromophore, and we bring in new consumers. So we will discuss cryomodulation shortly, but this is the use of precise controlled cooling, really targeting dyschromias, various dyschromias, and skin inflammation. And we do not target chromophore. So our technology is not using a wavelength to target any kind of chromophore. It's applying controlled cooling to target the skin. And then lastly, we really believe that this is a technology that when you bring it to your practice, it will help you to bring in patients who are new to aesthetics and new to devices and potentially external patients as well. And so it's something we think that is, very effective, very comfortable, and really leads to high patient satisfaction. So if we look at the system and the treatment, and the marketplace, there's a variety of things to talk about. First, let's look at the system a bit more. So as I mentioned, this is the system that has a very big chiller unit, but it has a very nice streamlined interface in which it's very simple to use. So on the left side of the screen here, you've seen what's called our global cryomodulation procedure, and it walks the provider through how to treat using the various color-coded icons on the left side. And then above, as you see in the focused cryomodulation section, you see the handpiece. That is the native handpiece of the Glacial RX system, and it delivers a focused freeze, or we call focused cryomodulation. And when we add a different tip, and I will show you pictures of our kit that go with global cryomodulation, you can deliver a different treatment. So it really allows providers to have the ability to customize their treatment journey for patients depending on their needs, whether the need is to reduce, lentigines or seborrheic keratoses, or to improve overall, skin luminosity and inflammation. This allows patients to choose if they want to do just focused cryomodulation, global cryomodulation only, or combine it for a very customized treatment. And the benefit of this treatment is it also provides precise controlled cooling during both parts of the procedure. So if we look at the science of our 2-part procedure, on the left side, you see that we have focused cryomodulation. As I mentioned, this is delivering a controlled freeze to the skin. It's quite a very quick freeze, so it's not something that takes a very long time. It's also not something that you need to have topical anesthetic or numbing for, given that the procedure itself is already, controlled freezing temperature. But what this procedure is doing on the clinical side is it's normalizing melanin production. As you know, sometimes with lesions on the skin, they're a result of overproducing melanocytes. So what happens is our handpiece tip touches the skin, and then ice nucleation forms in the epidermis, and they propagate throughout. So this basically injures the skin through mechanical injury because of the ice crystallization. And therefore, in that moment, the melanin transfer, from the melanocytes to the keratinocytes is then interrupted. So this procedure allows the skin to normalize melanin production in the area that was treated. On the right side, you have global cryomodulation. And the purpose of global cryomodulation is really to provide a sustained cooling to the skin that allows it to have a reduction in swelling and inflammation and the ancillary effects of inflammation in the skin. So there is an all-over cooling, as I showed you in the previous picture, that has a larger surface area tip. And this is applied in conjunction with various skincare topicals. And really, I think we've seen some really nice benefits in our patients where they're having some durable improvement in some of their results. Oops. So that is what happens. All right, so if we look at the histology of focused cryomodulation a little bit more, one of the questions I think people typically have is, okay, you're treating skin and you're targeting, these lesions that are pigmented. What happens to melanocytes? Well, I can assure you that we do not disturb melanocyte function. What we really do is just interrupt and suppress the melanin transfer. So on the left side, we see that after the treatment is done, in the histology on the right side of the left of this picture right here, you'll see that the melanin is congested. So, that means as it wants to be, moving up in its normal pattern, but it's a bit congested because it's been suppressed momentarily or temporarily for some time. And on the right side, we're showing a stain that's actually showing the prevalence of melanin in tissue. And actually what you see is that in tissue that's been treated, there is less melanin after the treatment. So what does this treatment look like? I know we showed you the picture very briefly, but on the left side, it is a very small 7mm tip that is native to the handpiece. So there's a button that activates the pre-cool section, which means it allows the tip to get to the controlled cooling at the profile that you've selected. Then the tip is just applied to the skin directly. And it's a little bit hard to see right there, but I will show you a video shortly. And essentially, you'll see that it counts down to do a very, very quick controlled freeze just on the lesion that you've selected. On the right side, we've got the global cryomodulation. So we have disposable tips that are added on top of this native tip. And this global cryomodulation tip is a flat tip. We have two different tips, one that is smooth and one that is a bit more rough. And they allow us to complete the procedure and provide cooling all over the skin to address global skin concerns. All right, so this is a video of what's happening. So in this case, we are doing a quick freeze or a focused cryomodulation. And in this part of the procedure, we're applying a topical, and we're in the middle of our global cryomodulation procedure. All right, so what are some of the outcomes of some of these procedures? So I mentioned they are pretty customized, meaning that you can choose to do focused cryomodulation only, in which you're targeting a lesion only. You can choose to do global cryomodulation, in which you're applying this globally on the skin, or you can do both, should your patient have those needs. So on the left side, we see the focused cryomodulation. There was a lesion treated here, and then after the treatment, you see that the lesion has cleared. Here, this one is a leg, and also the lesion existed here. And it's gone. And these are both after one treatment. In the middle, we have a combined version. Well, actually, let me switch to the very right side. So on the right side, we have global cryomodulation. We see that she presents with quite a bit of redness, and her redness is very much improved. On the bottom, we have a patient who's presenting with some patchy pigment, and after one treatment, her tone is improved and redness is also improved. And in the middle, these are patients who had lesions treated as well as the global cryomodulation portion. And you can see that they have an overall reduction in their redness, improved brightness, and the lesions have cleared.
Hey, Peggy, can you talk a little bit slower for the translators?
Sure,
Okay, thank you.
sure. I will speak a little bit slower. So if we saw the video earlier, you notice that there was a topical applied to the skin in the global cryomodulation portion. And during that portion, we're applying the all over handpiece tip to the whole face in conjunction with various topicals. So this is our suite of topicals that deliver these five products here deliver the global cryomodulation treatment. The product on the left is our hydrogel that facilitates the freeze during the focused cryomodulation portion. Prior to the treatment, we ask that the providers clean the patient's skin. This provides for a better outcome for the global cryomodulation, as well as it helps to facilitate the freeze for the focus cryomodulation. So this removes any residual barrier or topical load on the skin so the patient can optimize their treatment with Glacial RX. After the treatment is completed, there is a cream and a serum that is provided to the patients to take home. The cream is designed to help speed up healing and recovery for patients who have had the focused cryomodulation on spots on various lesions. On the right, there is a serum that is designed to help optimize the reduction in pigmentation so that the results of the Glacial RX treatment continue to be optimized for months. The importance of these topicals that we've included in the Glacial RX treatment is that they were tailored and tested for Glacial RX specifically. So we have a partner called Allies of Skin, and they've worked with us to make sure that this treatment is really optimized with our device. Additionally, the topicals are clean and don't have any irritants or known irritants to the skin or other ancillary fillers. And they are multi-benefit, meaning they provide multiple different beneficial outcomes to the skin, from brightening to exfoliating to increased luminosity. Okay, so let's look at what the healing looks like for a typical patient. In this patient, she had focused and global cryomodulation. So you can see this is her baseline. She presents with some lesions on the face. In the second photo, this is 2-day follow-up. She has 1, 2, 3 lesions treated. And these lesions have formed a crust. On the 7th day, about a week after her treatment, you can see that it's formed a bit more of a scab or a crust. And then it's fallen off shortly after. And at 1 month, the lesions are gone, her skin is improved, and the result continues to remain at 2 months after her procedure. Of course, every procedure is not without some amount of risk if we want to have outcomes for our patients. On the left side, because they are 2 different procedures essentially, with focused cryomodulation, there is a risk of post-inflammatory hyperpigmentation, but this risk is manageable by understanding your patient type, understanding how you treat, meaning we would recommend not treating a very large cluster in one spot or stacking. We would recommend that we look at the lesion and we apply the appropriate setting for that patient. And on the global cryomodulation side, this is a procedure that involves various alpha hydroxy as well as beta hydroxy acids. And there's other topicals that are exfoliating in the procedure as well. And so therefore, if a patient is sensitive to topicals such as these or retinizing topicals, they need to make sure that they are not on these topicals for at least a week or so prior to the treatment to ensure they don't have additional dermatitis. But it's generally a very mild treatment in the sense that this treatment, most patients who receive the treatment really enjoy it. But again, we are applying very many different medical grade skincare products there. So let me show you some before and after outcomes. So I showed you this patient briefly earlier. This is a closer look at her pictures. And you can also see in the Visia, the red version as well has very much improved. And she had global cryomodulation. So this is the all over treatment. This is a patient who actually had melasma, and she had just one treatment with global cryomodulation. And it didn't resolve completely, but it did improve quite a good time, and just with one treatment. The patient was very pleased. With this treatment, this is another Fitzpatrick 2, her 1 month outcome. And you can tell in general, she has a brighter color to her skin. Her redness is reduced as well. On the focused cryomodulation side, we saw this lesion, and her lesion has since resolved and cleared. And this is 9-month follow-up, actually, so that shows that the results are durable. On the right side, we see another patient who had clearance on the lesions, as well as improvement in redness. Here we have some darker Fitzpatrick skin types. So on the left, we have a Fitzpatrick 4 who had 2 treatments, and this is 2 months after their treatment. These are some extremities. So these are legs being treated. I know that legs sometimes, or off the body procedure, off the face procedures, are often more difficult for practices. So this is showing a really nice outcome in legs that were treated with focused cryomodulation. And in this one, it's a 6-month follow-up, and this one is a 3-month follow-up. Here is another result from a patient who on their legs had 5 lesions treated, and at 3 months, the lesions were cleared. Here is some other off-the-face treatments. So this is, behind the ear, and you can see that in these raised lesions, there is a nice outcome. Oh, I think we have that one twice. Here's a patient who had both. So they had 5 lesions treated here, and then they had global cryomodulation afterwards, and this is their 1-month outcome. And like I mentioned, this treatment can be done really anywhere on the body because it's not seeking any chromophore particularly. So you have nice outcomes on on the chest, the neck, the décolleté. Here is a patient who had both focused and global cryomodulation at 2 months. Here is a Fitzpatrick 4 with focused and global with 2 lesions treated, with 1 lesion treated, 2 lesions treated, and an improved outcome in redness as well. And then this patient had 4 lesions treated. And this patient presented, with a number of telangiectasias, and the redness has reduced, from his baseline treatment. And this is 4 months after his treatment. And this is showing a patient who had, this is before at baseline, at 1 month, 2 months, and 3 months. So she continues to see very nice results from her Glacial RX treatment that was comprised of focused and global cryomodulation.
Thank you for the opportunity to come speak to your physicians this evening. I appreciate Glacial RX and R2 Technologies for allowing me to speak to you all and kind of describe my experience with this device. And it is kind of an early experience as we adopted back in July. I'm going to share a slide with you, and if you give me one moment. Okay, so as I said, we adopted this technology in July, and one of the things we were interested in, and I will get into this a little bit further, was we have patients that we've seen and treated for some time, especially with regards to dyspigmentation, who had refractory or recalcitrant pigmentation despite the treatments we had available, specifically the light-based treatments like laser and IPL. And although those do work, I think, well for a lot of patients, there was a group of patients I felt that we were missing or had persistent problems with pigment that we weren't treating effectively. So let me tell you a little bit about my practice and my staff, so you understand the composition of my office. I'm a solo practitioner in plastic surgery, so I'm going to give you my perspective from a plastic surgeon's point of view. My practice is 100% cosmetic. Although I am a surgeon, we still offer a full breadth of facial cosmetic procedures in the office, which are surgical as well as non-surgical, and this does include both light-based technologies, including now we're discussing R2 and Glacial RX, as well as the full range of neurotoxins and dermal fillers. My clinicians include 2 estheticians, a physician assistant, and a nurse who assists me in the office. The current therapies that we have, so you have an idea of what I'm comparing this against, includes both topical therapies, which I think we all have available to us, which would include the retinoids as well as hydroquinone, the various peels for chemoexfoliation, microneedling, which is more rejuvenative, not so much for pigment, but we still offer that, IPL, intense pulse light therapy, which has kind of been my backbone for pigmentation up until this time, ablative lasers, and now cryomodulation. I will mention in passing that we had cryosurgery available, principally nitrogen, but I've kind of let that go because of some issues I had with that in the past. So what were the factors that we considered with regards to adopting this technology? And I think Peggy hit on some initial reasons why, and this had to do with the reputations of the founding scientific members of Glacial RX. And those physicians are pretty well recognized in the United States regarding medical device development, and specifically with regards to aesthetic medical devices. And so their reputations precede themselves, as does the institution that they are from. So unfortunately, I didn't have the benefit of having a physician or a group of physicians I could speak with, or having kind of a webinar type environment where this could be discussed with me prior. So this was a pretty important part of my, I guess, decision-making process, is knowing the individuals behind the technology. I also had experience with a coal-based technology, which was not used for facial aesthetics, but was used in the fat or cryolipolysis arena. And what I did notice, and this is anecdotal, at least on my part, was that we saw differences or changes in the skin that appeared to be of benefit. We saw improvement in skin elasticity and whatnot. And I do know that this current technology has an indication to address that. So there was evidence of some degree of rejuvenative changes in the skin. Although this wasn't directed at pigment, it was something that, again, you could base a decision on in a more favorable fashion. And as we move on, I had some experience with representatives locally who were involved with R2 Technologies and Glacial RX. And my previous experience with them has been very, very positive. And I have to say that was probably one of the more major factors in deciding on going with this technology. Because I do believe that at the end of the day, with this technology, what makes the difference is going to be the customer service that you experience with your local representatives. And I will talk more about that a little bit later. So what about this therapy? What about this treatment do I like? I mean, obviously it is a novel therapy, and I know Peggy spoke to you about cryomodulation. What I like about this is that it is a controlled cooling of the skin. And unlike traditional cryosurgery, which to me was a little haphazard in the sense that it really depended on what your freeze thaw cycles were, how much time was involved for the freezing, how many times did you have a freeze, or how many times did you go through a freeze thaw cycle, how many different treatment cycles were there. And that seemed a little imprecise. I was also concerned because I would see patients, not necessarily of my own, but also patients who were referred in, who would demonstrate some hyperpigmentation following their treatment with more traditional cryosurgery. Going on with regards to the flexibility of the treatment, and this is again something that Peggy had hit upon before, it is a treatment that you can use both for focused treatment of hyperpigmentation, and these are typically the hyperpigmented maculas, the lentigo, that tend to be a little stubborn to the more traditional therapies. And you have the more global treatment, which I think is very nice in that it gives a more uniform treatment for the facial skin. I think these couple very well. However, you don't have to use them combined. You can separate them. So if you have a patient who simply wants to undergo a focused treatment of their skin, they can do that. The issue of treatment being provided by one individual versus the next, I'll have you know that at least in the state of Florida, and I'm pretty certain throughout the United States, that any provider, from an esthetician to a nurse practitioner or physician assistant, as well as a nurse, could do this as long as they were certified, and we are a certified practice. I like the fact as well that living in Florida, we are considered the sunshine state here in the United States, and because of that, I am somewhat seasonal with regards to some of the treatments that we offer in terms of the light-based treatments. Because cryomodulation isn't as restricted with regards to that, we can be a lot more flexible with our patients in terms of when we treat them. The other nice thing about this treatment is we can treat just about any site on the body. And that's also nice because as opposed to just treating the face, we do have light-based treatments that really are FDA cleared to really address facial skin. I can apply this treatment to the face, the décolleté, and again, as Peggy mentioned, even on the legs. So a lot more flexibility with regards to treatment location. So I would consider this more a primary treatment now for pigmented maculas as well as benign skin lesions. In my office setting, we are principally treating dyspigmentation. However, we have treated a few benign skin lesions, typically seborrheic keratoses. But I will also consider it now as an alternate therapy to existing patients who are undergoing light-based treatments who have not really achieved what I would consider an ideal aesthetic goal with regards to pigment reduction. There is an indication, as you're aware of, or has been discussed with regards to treatment of inflammation, swelling, and bruising and or hematoma. And I think this is an interesting one. You see some of that reduction in the photos that were provided by Peggy with regards to the facial redness. I kind of look at it a little bit differently, and I guess I'm looking at it from the perspective of a plastic surgeon. And I want to know that I have a potential therapy that I could use in a post-operative patient, for example, who's undergone eyelid surgery or facial or neck surgery, which may help promote a speedier recovery, as well as make the overall process a little bit more comfortable for them. And by extension, I would also say that this probably has a role with regards to treating patients who are undergoing neurotoxin or dermal filler treatment. And of course, I don't pretend to be the world's expert with regards to injectables, but I will tell you that it's pretty predictable that a certain percentage of your patients will experience bruising, especially with dermal fillers. And I know that based on the FDA trials with regards to Juvederm products, bruising, for example, was reported about 50 to 60% of the time. So this is not an uncommon problem. So if we have another tool, so to speak, to treat something like persistent bruising or swelling after an injectable treatment, I think this really helps benefit you greatly and will help make your practice stand out from the crowd. In terms of the economic considerations, and I know this is important for everyone, and I look at this at many different levels. I think the first thing you need to keep in mind is this will be a referral base for new patients. They will come in recognizing that you have this new technology and a technology that's able to provide a treatment that is very comfortable. And I think by virtue of just word of mouth alone, you will have referrals from those patients, which will help grow your practice. You obviously have your existing patients, and I'm assuming most practices keep a database of those folks, and I am able to draw on my existing patients very well. And as we brought this technology on, we had the majority of our patients were actually existing patients, and we've got, I think, a lot of good feedback regarding the treatment, and also a source of additional referral as they spoke to their friends and family regarding their treatment. We mentioned this as a gateway to other aesthetic procedures, and I think this is also very important because I believe in most dermatology or plastic surgery offices or a cosmetic medicine office, you offer other procedures that could act as adjuncts or parallels to Glacial RX. So as a patient comes in to have their hyperpigmentation, it may spark the conversation regarding the use of a neurotoxin or dermal filler, or even something if it's surgical, if you're a surgical practice. So this is very important because I think you are inevitably trying to grow your practice. I think you get an initial benefit from having Glacial RX with regards to patient treatment, but there's the long-term benefit as it will help continue to grow your practice. I mentioned existing patient retention because I will say in the past, before I had these other light-based technologies, and that we would refer patients out for a treatment, and it's, say, for example, a patient who had hyperpigmentation, and they may be referred out to a dermatology or a plastic surgery office. And the problem with that is, and I don't know if this is a problem in Mexico, but I will tell you in the U.S. it's quite competitive. And once a patient is referred out, there's no guarantee that the patient would come back to your office. So I think it is important to keep that in mind as time goes on, because I do believe this technology is going to grow rather quickly, and you would like to be on the early curve with regards to adoption of this technology. In terms of the return on investment, I know this is very important for everyone because there's an investment up front with regards to purchasing the device. What I will tell you is just based on my experience in terms of the patients being brought into the office, I'm pretty confident with regards to the patients that we're seeing that in terms of if you want to consider the payoff with regards to the device, in terms of what we invested in, we should be at that point in terms of the break-even point within about 12 to 18 months. So that to me is very good, considering that my esthetician is the primary provider for Glacial RX, and she's just starting with I think a very good core set of patients, and her new referrals into the practice is growing I think pretty steady. So given what we've seen in terms of the growth and patient influx into the practice, we should achieve that goal, I think, without any problem. So I don't want you to worry about the cost, although I know it's always a concern. So moving on with regards to results, Peggy really presented, I think, a very thorough and a very nice presentation with regards to the before and afters, and not just with regards to the spot treatment, but also the global treatment. And it is nice to see those kinds of results mirrored in your own practice, and that was what we are experiencing. From the FDA standpoint, obviously this is a procedure that has demonstrated both safety and efficacy. We're very pleased with the results that we've seen with regards to our patients. Patient satisfaction is pretty much been consistent across the board. I haven't had anybody complain with regards to this, and that is definitely a plus in my book. We've seen localized pigment reduction and clearance in every patient that has been treated. There has been generalized improvement in skin tone, and that is nice because it does give us some flexibility with regards to who we're treating. And so I think that as time goes on, we can definitely try to capture the facial rejuvenation patient population and not just focus on pigment or benign skin lesions. In terms of the comfort, and this is probably I think the game changer with regards to Glacial RX. My ablative laser and my IPL, as much as I like these devices, they carry with them a certain degree of discomfort when the treatments are done. And for example, with my laser treatment, I'll have a patient undergo a laser resurfacing, and even though they have their safety goggles on, I can tell that there's a degree of discomfort, and I've even seen tears start to run down their cheeks. Now, as a provider, I don't like to see that, and I would much prefer them not feeling that. So it was a kind of a blessing in disguise to have a treatment available that would allow us to treat pigment, for example, and not create this kind of adverse reaction in the patient. It makes you feel better about yourself if you're able to provide a treatment where the patient is actually smiling and comfortable throughout the process. So I do mention it is like a spa-like experience, and I think that is probably a good analogy. It is obviously a medical treatment, so I don't want you to lose sight of the fact that it is a medical treatment. However, the patients do experience something much different than what you would expect in the setting of intense pulsified or typical laser resurfacing. Our staff experiences have been very positive, and I get a lot of feedback from my esthetician because we talk about this pretty consistently and regularly. She's been extremely pleased with the results, and she's had the benefit of seeing patients undergoing these other treatments as well. She likes the fact that it is a very easy procedure to complete on her patients. We have dedicated a room as well as the appropriate ancillaries that are necessary for her to complete her treatments there. She is very enthusiastic. She's actually provided some video testimony to R2 Technologies regarding her experience with the treatment. So I am pretty confident that your staff members, if they are the ones providing this treatment, will have a similar experience. In terms of your practice support, again, I will speak from my experience here, and I'm sure Jacqueline and Antonio will provide the same experience down there. We have what they are described as practice development managers, and I think that kind of hits the nail on the head. They are there to see your practice develop and grow, because as you grow and become more successful with this treatment, they will obviously benefit as well. So they partner with you, and you should consider them partners throughout your ownership of this device. And if you have any problems, they are very responsive. I've never had an issue trying to get in touch with my PDM locally here. Marketing is provided through a number of different avenues. They have a pretty strong social media presence currently, and I know that will continue to grow. They obviously have their website, and the US website will link to your practice. And it is kind of nice early on because you tend to be one of the few practices available, so you do stand out. In the US, they do provide what's called co-op, and I don't know if they'll be doing it in Mexico, but just to let you know, they're helping to support marketing with your practice in conjunction with Glacial RX. So that is a nice program. In conclusion, let me just remind you, in my opinion, I think this is a technology that will be a game changer in the future. It is transformative, at least in my practice, because it has allowed me an alternative treatment to something that otherwise was relatively uncomfortable for patients, and whose ultimate efficacy I don't think compared necessarily to Glacial RX. I don't believe this is going to be a fad. I think this is going to be a trend. And I do believe cryoaesthetics is going to be a growing segment in the cosmetic medicine industry. And there's a lot of growth potential here. And now we're looking at it at its infancy, and I believe indications will continue to grow as time goes on with this device. And I think at the end, the way I would describe this to you is that if a patient or if another physician asks me about this device in terms of my satisfaction with it, I'm more than pleased. And if another physician, another peer asked me about whether or not I would purchase this device, I would have no hesitation in telling them I wouldn't hesitate in a moment. So I think this is a great complement to any cosmetic facial plastic practice, whether it's dermatology, plastic surgery, or if it's cosmetic medicine. Obviously, this will get into the Medi-Spa practice as well. I think this is something that will make you stand out against other practices. And I think this is a good reason why adopting technology early, at least in this setting, makes a lot of sense. And I think that there should be little reservations about doing this, because I think the proof is in the pudding, so to speak. And I think the results speak for themselves. Thank you.
Awesome. Thank you so much, Dr. Moraitis. We really appreciate you taking the time. One of the questions that we received while you were speaking was, what other devices do you have in your practice, and how does this device fit in, and how did you position it? Okay.
So we have microneedling for general facial rejuvenation. This is not necessarily directed toward pigment. I have a laser platform that allows me to complete both intense pulse light. It has an infrared handpiece for skin tightening. It has an ablative laser handpiece. I have two cool sculpting devices, and now I have Glacial RX. Glacial RX stands out separate from the IPL and the laser. And I say that because I have patients who are just either from previous experiences, and I've had this happen on many occasions, where we will discuss issues regarding their skin or pigment, and they are not accepting of additional IPL or laser treatments. They're very much averse to it based on previous experience. And I can't speak to their specific experiences. All I can tell you is I can validate it because I understand that it can be uncomfortable. So this runs directly at those particular patients. It provides you the ability to treat those patients and do it comfortably. And it's not a, and I don't want to use it as necessarily as a adjunct to those treatments. I would like to use this as the primary treatment because I actually think it works better compared to those. And I can be more flexible with that. So if in the middle of summer, for example, in Florida, I'm not necessarily going to be inclined to really encourage IPL or laser for fear of potential secondary like thermal injury because of actinic bronzing or redness from mild sunburn, these sorts of things. So it is positioned in such a way where it is a unique treatment, but it will probably be our primary treatment for pigment. And my esthetician is one of the individuals who's also seeing patients outside of my primary clinic practice, and she's also recommending this as well. So my physician assistant, who is seeing principally my injectable patients, is also seeing this as the primary treatment for pigment. So it's not going to probably take away from some of the patients who I think will do well with laser. Those will be the patients with, for example, the coarse wrinkling, for example. I like IPL for rosacea, but I have a feeling I'm going to start switching more and more toward Glacial RX because I'm seeing very favorable responses in patients with that kind of diffuse erythema in the cheeks. So I think this is going to be something I can rely on more and more and not feel as, I don't want to say disappointed, but less than enthused with regards to my pigment treatments in terms of what I was seeing in patients with IPL and laser.
Awesome, thank you. We have a question here from the Dr. Gabriel Huerta. He's asking if there are any risks of hypopigmentation and at what degrees do we treat? Well, doctor, we don't tell the degrees. If not, everyone will get our system, but I'll let Dr. Moraitis answer that first question about risk of hypopigmentation.
So in my practice, I haven't seen it. And there are different settings for the device, and we are probably not extremely conservative, but conservative because there's a little bit of a learning curve, at least on the part of our staff, feeling comfortable with using this device. We've seen very significant improvements in pigment. I have not seen any hypopigmentation. Now, I'll contrast that to traditional cryosurgery, where I've seen patients have a seborrheic keratosis or a lentigo frozen, and the post-treatment effect is much lighter than the surrounding skin. And unfortunately, that is going to be a permanent result as a consequence of that treatment. And I think this speaks volumes to the controlled aspect of the cooling that's carried out at the level of the skin. Whereas, as I say, with cryosurgery, there's typically these freeze thaw cycles, which may vary from one practitioner to the next. They may vary in time. Even where the applicator is applied in terms of distance from the skin may vary from one practitioner to the next. So I don't like that. I like what I'm doing to be very reproducible, and I think that can be provided by Glacial RX. I think cryosurgery, I'm sure there's more muscle memory. You kind of have a conditioned way of carrying out that treatment, but I'm always worried about hypopigmentation with cryosurgery. I have not seen it with Glacial RX. I will say that I know they mentioned some concerns regarding hyperpigmentation, and I will say I have not seen that in my practice with regards to the patients we've treated either.
Amazing. And I think Peggy wanted to answer a little bit about the hypopigmentation.
Yeah, thank you so much, Dr. Moraitis, for providing your experience. I wanted to provide some of the clinical background from R2 Technologies. So it's a good question on hypopigmentation. And really, when you see hypopigmentation, the question then becomes, are you destroying melanocyte function and structure permanently? Which is why in technologies that are extremely cold, like with liquid nitrogen, which is negative 198 degrees C, you may see destruction of this. It's an extremely, extremely cold temperature, and sometimes it's just certainly not as controlled as ours. And I can tell you, as Jacqueline mentioned, we can't give you the exact algorithm of how our treatment works, but we can tell you that our range is roughly, negative 10 to negative 20 degrees C. So therefore, we are much, much more controlled and able to remove the lesion without destroying melanocytes so that you don't have hypopigmentation, which then becomes extremely difficult to treat for the patient.
Awesome. Thank you, Peggy. And the Dr. Huerta also asked us, how long does the full face treatment take? And what are some of the assets of the products pre and post treatment?
Okay, so let me speak to the duration of the treatment. From the moment the patient comes in, if it's going to be both a focused treatment as well as a global treatment, the patient will probably be with my esthetician for approximately 45 minutes, 40 to 45 minutes. In terms of the skin types that we've treated, the majority of these patients have been Fitzpatrick's 2, 3s, and 4s. I believe we may have treated at 1.5, but it can be used in a type 5 Fitzpatrick skin, as far as I'm aware of. The assets of the products. I don't know if I understand that question in terms of what's being asked. So there are products that are used during the global treatment that come in a kit, and maybe I'll describe it this way, which Peggy has gone over. And then there are products that provide post-treatment that we would have you continue.